You can come in now if you like, but I wanted the Minister again, but you can't.
Okay, well, you're very good. Thank you very much. And Minister, you know, I think it is very good when you spoke about voluntary homes and care homes is one that we have in Carlow and Kilkenny, and I want to thank you for the funding. But when we speak about, as Deputy Crowe said, about particularly for care homes when funding is needed, and we all respect the HECRA reports and whatever, but I spoke to you recently about maybe looking at local authorities, that they might look at grants. If a HICWA inspection came on, they wanted an extra maybe bedroom or bathroom or something like that. Maybe we could look at different departments helping your department, Minister, with grants, so that if there was any one that was under pressure, that we would all work together and try and get that extra funding. And just one other thing, I had a nursing home on to me there recently where all the residents are being have medical cards, but they're all being charged for their bloods. And I'm just wondering, is there anything we could do to help these residents? You know, and I think it's important that, you know, that they don't have these extra fees. And thank you for all the work you're doing, Minister. Thank you.
And first of all, thank you, Las Concorda, and thank Deputy Crowe and Minister Butler for their kind comments. Thank you, Deputy, for putting down this question. Following many months of extensive negotiations in the Workplace Relations Commission, the WRC, an agreement was reached in November 2023, which saw an increase in funding for pay of staff in Section 39 organisations and also Section 10 and 56 organisations. An overall increase of 8% was agreed, phased with an initial increase of 3% backdated to April 2023, a 2% increase from the 1st November 2023, and a further increase which came into effect on the 1st of March 2024. It is important to acknowledge that the vital role that these organisations and their staff play in our health and social care sectors. They continue to have a key role in providing services to people with disabilities, vulnerable children, older people, and in other social care settings. Government has a clear interest in ensuring the stability and sustainability of these services. The objectives of the HSE is to ensure all employees can access their entitlements under the WRC agreement. They have already made significant payments to qualifying organisations and continue to work with each of the organisations to ensure payments are made without delay. As this process continues, it has come to light that there are other community groups who are funded through different pathways, and although operating similarly are not technically Section 39 organisations, such as local drug and alcohol task force groups, who have not been encompassed within the existing process. The Department is now aware of this issue that has arisen and is liaising with other relevant departments to explore how this matter can be resolved satisfactorily in a timely manner.